The following is a review of specific questions from the Practice of Cardiac Sonography 1 end of semester written and practical exams. The written exam questions reviewed are those that proved most difficult. In relation to the practical exam, I've made some general comments. Firstly, some short answer questions from the written exam. In one of the questions, you are asked to describe how 1. Correct caliper placement and 2. Correct image alignment are made when measuring left ventricular diameter from the parasternal long axis view. Firstly, to ensure correct caliper placement, identify the black and white tissue to blood interface, and ensure the measurement is made perpendicular to the long axis of the LV. And secondly, ensure that both mitral leaflets and 2 aortic cusps can be seen to ensure that you measure the center of the left ventricle. Another question asked with specific reference to ultrasound beam orientation in relation to tissue interface, describe how optimal 2D images and Doppler images are acquired. Firstly, optimal 2D images are achieved with a perpendicular, that is, 90-degree angle of incidence between the beam and tissue interface. Secondly, optimal Doppler images are achieved when the beam is parallel to the tissue, that is, parallel to the direction of the blood flow or tissue movement. This graph displays the distribution of marks for the Practice of Cardiac Sonography written exam. For the 23 students, the average mark was 26.5 out of 35, the high 31.5 and low 20.5. Some general comments about the practical exam. More attention needs to be given to making adjustments to machine settings. Machine settings should be optimized for each patient. Moreover, for 2D imaging, frequency, gain settings, focus, set to width should be adjusted with each new window. When Doppler imaging, settings should be optimized each time a measurement is made. Some other aspects. When acquiring apical images, aim to start low and lateral. This will help to ensure you display the heart's full length. That is, you'll most often avoid a foreshortened image. And when interacting with patients, aim to be polite and respectful always. When giving instructions, be very clear about the position that is required and make small adjustments to the patient's position throughout the exam. This graph shows the distribution of grades for the Practice of Cardiac Sonography practical exam, where 23 students completed the exam. The average mark 39 out of 50, the high was 46 and low 31.